It's estimated that there are between 2 and 4 million amputees in the United States. The reason that the number is not more definitive is because, up until now, there's been no mechanism in place to track them. But that's all about to change. A new database has been developed that will track the treatment of patients from diagnosis through aftercare. It's called Limb Loss and Preservation Registry, and according to experts, it will change the way that healthcare professionals, insurance companies, and patients themselves will manage care.
There's a lot of lack of knowledge about the industry, about the condition, and about the care management and the intervention that goes into this field.
We sat in Washington, D.C. in December of 2001 and built the playbook on how to rehab amputee patients from our war. And with that, we started essentially from scratch.
And that's pretty sad that there's gaps in the data. We're citing 25 years ago data on, there's 2 million amputees, there's 2.1, there's 4 million. How many get legs? How many don't, right? And so we just don't know what we should know about our patients.
What we do need is a single source of truth so we can mine the data, get some insights that will be consistent and to help the clinicians understand what the best care management track would be and what the best outcomes can be attained.
While the registry will help practitioners and insurance companies in making care decisions, it will also help patients engage and manage their own care.
At age 10, I was in a car accident and lost my legs below the knees and went to a rehabilitation hospital for about 2.5 months, learned how to walk on prosthetic limbs. I've had 14 sets of artificial limbs over 49 years. 2 years ago, I got a new set of artificial limbs, and there's a new mechanism called vacuum suspension. There's a negative pressure or a vacuum that's formed. I was very reluctant to try that because of my particular situation. So my prosthetist waited about 5 or 6 years to present that to me, and worked with other patients. He said, I've been through this with 8 or 9 people, and I can tell you that this is something we should try. I tried it, I love it. That's a microcosm of what the registry can do.
Development of the Limb Loss Registry was slowed during the COVID pandemic, but it has recently begun to be populated with data, and those who have been working on the project expect big things.
When you restore mobility for even one patient, you actually get them up and mobile and fully participating in their lives, in their communities, in their families, in their work life, so that you have full members of society able to reach their full potential.
Healthcare data is evolving quickly, and so registries of the future are really collaborative data hubs linking hospital, prosthetist, orthotist, and patient-reported outcomes measured data over time, as well as potentially connecting to other registries to bring the entire care picture of patients into focus.
So I was just in Germany, and they're starting an amputation registry, and they're patterning it after what we've done here.
Knowledge is power, right? So the more information we get, the more we can do to make better decisions.
Limb Loss and Preservation Registry, developed and supported by the U.S. Department of Defense and the Eunice Kennedy Shriver National Institute of Child Health and Human Development.